By Kuzo Eye Care. You may think of summer as being hot and humid, but for sufferers, dry eye doesn't take a vacation. Dr. Melissa Kuzo is here to offer relief, plus a special Dry Eye Awareness Month special. So Dry Eye Awareness Month, it is approaching. What is dry eye disease?
Yeah, so the unfortunate thing is that dry eye is really a blanket term for the disease. So this is things like inflammation of the eye. This is lack of oil on the front surface. This is things from even diabetes and just things that we take medications for on a regular basis, like allergies. So really, when we say dry, it doesn't mean that you feel dry always. It could be burning, blurring of vision. It really is just a blanket term that we use for anything that affects that front surface.
So it's nice to know it's a real thing, though, because sometimes you wonder, like, what is going on? So how do you know if this is what you have?
Yeah, so sometimes it's hard to tell. Not everybody has symptoms, but burning, itching, watering, blurry vision that just kind of, comes and goes. Even sometimes just loss of clarity. I mean, it's really one of those things that if you don't have checked, you may not know.
Yeah. What causes it?
So there's a lot of things that cause it. So our medications we take, certain diseases we may have, again, autoimmune diseases being a really big one, allergies this time of year. I mean, there's a gamut of things, even staring at our cell phones, which everybody's doing all the time.
Absolutely. When you go into a store, though, or like a CVS Ready, there are lots of different drops there, and I've tried a lot of them. Do these help?
They are a very temporary fix. So if you are someone who maybe goes on an airplane every once in a while, gets a little dry, sure, try a lubricating drop. But unfortunately, sometimes it's more harm than good. So really, we want to see what's that underlying cause. Is it, an issue with not blinking enough? Is it that you're under bright lights, wearing makeup? Are you staring at a screen? So it's really important to have a full evaluation, and we do that at Kuzo Eye Care.
So if you detect that somebody does, have this, like if the drops are not really going to do it, the over-the-counter drops, like what are some of the treatments?
Yeah, so our office, we actually have some technology that others don't. So we always make sure that we're doing diagnostics. So we actually image the oil glands in your eyelids, which most doctors don't do.
Wow.
We check for inflammation as well. And then it's really the treatments that stand out. So we have an amniotic tissue that we use, and that really helps heal the front surface and helps regenerate corneal nerves. So that's a really great option that we have. We also have what's called intense pulse light, or IPL, for people that suffer from rosacea, which also affects the eyes. We also are the first in our area to have the luminous radio frequency. This is really nice for our ladies because this not only helps those oil glands, but also has the side effect of skin tightening. So who doesn't love that? Who doesn't want to have some anti-aging
side effect? Oh my gosh, sign me up. So lots of different options, and because July is Dry Eye Awareness Month, you actually want to pass along an offer.
Yes, so any of our dry eye packages, and that includes some of those things I just mentioned, so radio frequency, low light level therapy, intense pulse light, or IPL, we are actually offering 10% off in the month of July. You just have to mention Good Day PA.
Yes. Mention Good Day PA and save money. You must have a lot of folks come in and just don't really know what's going on, and once they get the proper treatment, it must feel so good.
Yeah, so that's why I ended up in dry eye. When I was studying in school, we were learning just about lubricating drops and just the early kind of, understanding of dry eye. And now there's been this huge explosion. I mean, you see in front of me a ton of things for at home, and those are more maintenance products. But really, I mean, the capabilities are endless, and there's always something new, from nasal sprays to in-office treatments and beyond. And it's just a great feeling when people leave with no symptoms.
Yeah. And you finally get that relief and you realize it really was something going on there.
Yeah.
Thank you.
Yeah.
Good to have you with us today. The previous portion of Good Day PA was sponsored by Kuzo Eye Care.